Oh. Check, check, check. Check. That's not right. Check, check, check. Okay, so I can't quite tell what's going on with the audio. Um, my guess is if you're watching on the YouTube stream, the audio quality is probably not as good as it usually is. So let me know. If you're on the YouTube stream, can you let me know if you can hear what I'm saying? And then also how bad the audio quality is. Like, is it understandable and everything? It looks from the meter like it's certainly not great audio quality, but it looks like maybe it's workable for today till I figure out what's going on. So let me know if it's a problem. You can hear it. Okay. All right. And sorry if it looks like I'm gonna. Let's see if I can keep this from clipping. Let me see if I. Okay. I shouldn't clip anymore. Hopefully that'll be okay. Um, Sometimes stuff just gets out of sync, and then if you restart the computer, everything works right, but it's kind of hard once you have everything set up to reset. So um, let's get into it. It sounds good. Okay, so let's get into stuff. So what do I need to show you? So I'll be showing you some stuff. So if you want to jump on the YouTube stream, you can see the visuals a little bit better than you can obviously in Zoom where there's just the green screen. As always, however you want to listen to these meetings, go for it. Okay, couple things to point out. Let's start with the instructional calendar. So your last two homework assignments are up. So what I want you to notice, if those of you remember I extended the homework assignments, and so all those are due on the 10th, which is tomorrow. Okay, except there's two new homework assignments, and those you get a couple extra days on. So let's see. I'm gonna have to extend this over, go week 18. Oh, week 19? There we go. So you can see there's two other chapters that are due, but I give you a few extra days on those. So sometimes, one thing that happens sometimes is students make big assumptions about things. So like, for instance, I have these homework assignments due on a different day. So I wouldn't be surprised if I get an email from someone saying, oh, I thought all the homework was due on the 15th. Because I saw these two assignments were due on the 15th, so I thought they were all due on the 15th. Don't do that. Just look at the due date that's for an assignment, and then trust that, right? Don't make assumptions about when it's going to be due. Look at it, because otherwise you're going to end up not doing all the assignments. So the two newest assignments, I give you a few extra days to work on. Otherwise, all this other stuff due on the 10th, and you've had lots of time to work on those, so that's fine. I'm giving you a few extra days because we're just assigning those new ones today, so it makes sense we'd give you a few extra days to work on the brand new stuff. But the stuff that we've had for weeks and weeks, in some cases months, kind of should be further along with those for now. So just realize two new assignments, you get a couple extra days to work on it. On those two assignments. Okay, with that said, then final exam schedule, which I know we've talked about before. So just be aware, we are a Monday class that meets at 1 o'clock. That means that your final is on the 5/16 from 12:30 to 2:30. Now that's the last time that you can do that test. I'm going to set it up so you can do it early, but you can't do it any later than that. So please don't wait till the last minute. Please don't wait till you're like, all of a sudden a problem is occurring. Take the test hopefully at least a couple hours early so that you can get it completed. And then if there's a power outage or any kind of thing like that, you can still go to the school and work on the school's computer or some kind of issue like that. But if you wait till the last minute and then problems start occurring, it means you're going to get an incomplete test score, which usually means a low test score. Okay, so when will I open it, the test? So here's what I'll say. Let's see. The test will be due at the time of the schedule. So that's the 16th. So what I'm going to do is I will definitely open the test by Friday. So the 13th, which you can't quite see on here. So the 13th, I will definitely have the test open. So you can take the test any time between the 13th and the time that it closes on the 16th. Remember, it closes at the end of the final time. So while you're used to assignments being due at 11:59, the exam will not be due at 11:59. It will be due like whatever it said, 2:15 or something. 2:30. Okay, so make sure you get it done in plenty of time so that that's not an issue. So there will be a practice test that will pop up in the next couple of days, and then there's going to be the actual test, which you then need to conclude. So please look closely. I will label them well. Don't take something called practice test and think that you just took the final exam. Okay? The practice test is to just give you, it's a resource for you to use to study and work through stuff, but it is not the actual test. So the practice test will probably go up Tuesday or Wednesday. Give you a little bit of time to work on that. The actual test, I'm saying, will be up by Friday. It may be up Thursday. Kind of depends on how things are looking. It may be up Thursday. It will definitely be up Friday. You can take the test early, but you have to have it completed on time. So hopefully that made sense to everybody. Will we get our final grades by Monday? So do you mean for the whole course? So Allie's asking, will we get our final grades? Do you mean course grades or do you mean like homework grades? The homework grade should show up in the homework. It should show you like roughly where your percentage is at. For the whole grade, yeah, so that's a great question. So here's how it works with course grades is, let's see, a couple questions. So will the practice test be graded? The practice test will count as a homework. So that will just get thrown in with your homework assignments. So it'll be, worth the same points as a normal homework assignment. And then the exam grade will be itself. Do not look at grades given on this homework sheet as far as being your course grade. They're not calculated in there. The course grade is, I take the grades into Excel, not Excel, but like Google's version of Excel, Sheets, I guess it's called, and I do all the calculations in there to get your grade properly calculated, okay? As far as course grades, so that's a great question. Here's how it works. There's a lot of pressure on us to get grades turned in as soon as possible, right? Because students are waiting on things like financial aid considerations. Sometimes they need to wait, make sure you passed a course or something like that. There's different financial aid considerations. Some of you are transferring places and you need to send them your transcript. And there's lots of things taking place. So there's a lot of pressure for us to get our grades turned in as fast as possible. So basically what will happen, although I do have 2 finals on Monday, I have a morning final and then this final. So it's possible that I wouldn't get till this class until the next day. It just depends how fast I can move through those 2 courses, right? But I should have final grades prepared for this class on either late Monday or, first half of the day Tuesday. So how does that work? So there's a couple things. Basically what happens when I calculate your course grades is I submit them to the school, and then within a few hours they should show up in your portal. Right? It takes a little bit of time for the system to go through and finalize grades and do all that kind of stuff. And sometimes it happens at midnight. So if I submit them, the next midnight it goes through and does what it needs to do to run its little tasks and then post grades to the students. So it's generally the next day that you would see your scores. Now, I don't email out particular grades, specific grades. There's two reasons for this. One, we're actually not supposed to, because when we email, like there's laws in place to protect your privacy. Just like as you'll see, when you're working in your future job, there's laws in place to protect your patient's privacy. That's the same thing at school. There are state and federal laws protecting your privacy. So I can't just go to like whoever, even if they're a school employee, I can't just go to people and start talking to them about your grades or your private information that I have access to as your professor. Even if it's another math professor, I'm not supposed to talk to people about information unless it's relevant, right? So like if it's a dean who has to make a decision about the class, I may have to give them information or something. But other than that, we're not supposed to share information. And if you think about it, email is not exactly secure. If I send out an email, do I really know it's you on the other end? And there are cases where, sometimes a couple shares an email and then they break up, and then, we send out an email, but the significant other still has access to that account. And so then I've just shared information with someone who wasn't you. And this leads into problems for a lot of reasons. It even can endanger accreditation at the school if we're known for being bad for that. So we're not supposed to email grades. Also, if you think about it, I have a couple hundred students. If I'm emailing everyone their specific grade, then what I'm not doing is grading my other classes. So it actually slows the process way down. So what I do is I compute grades as soon as I can. Oops, let me change this setting here. I compute grades as soon as I can. So that, like I say, that will either be late Monday or probably early Tuesday, since I have the 2 final exams on Monday. I can't guarantee I'll get to this class on Monday. I'll submit them, and then your grades should show up in your VC portal. So the same place that you go to register for classes and check your grades and do all that kind of stuff, the portal, your grades will show up in there generally the next day. So whenever I have them completed within the next day, you should be able to see what those grades are. Now, if something seems totally wrong, like it seems like an error was made, feel free to contact me, right? If you earned a B and I accidentally gave you a D and it's clear that there was a mistake made, then let's fix that. The sooner we fix that, the easier it is for me to fix it. The longer it goes on, if you come back in like 6 months and say, I think there was a mistake, we probably can't do anything about it. As far as like, people wanting a better grade, I usually already do any kind of rounding that's going to occur for a grade. It will occur before you see it. So sometimes, a student was like, oh, well, can you just give me this better grade or whatever? Probably not. Like I take all that kind of stuff into consideration before I submit those final grades. Now, if you had a special situation that you want to remind me about during the semester, like, sometimes someone was sick with COVID and they missed 3 weeks or something of stuff and they got a little behind. If you want to remind me of that, you feel free to do that now in an email so I kind of remember that when I'm going through grades. But any kind of rounding and stuff like that is generally already built in. So there's a question here about the practice and the final exam. Those will show up in the same place as your homework. So the WebAssign that you're seeing right here where you're doing the current homework assignments, that's where the exam will show up, is inside of WebAssign. So make sure you go there. That's a good question. I'm glad you asked that. So what you'll see in the next couple days, you'll see something pop up in here that says practice exam. So like all these homeworks you have, you'll see one that says practice exam, and then you should see one that says like an exam, like final exam. I don't know what I'm going to title it, but something like that. So make sure you do those two, right? One should pop up in the next couple days, and then one should be up by either Thursday or Friday, and then you can go through and you can complete those in the manner that you feel is the best to do that with. Okay, So I think I've answered all those questions about where the grades are going to show up and that kind of stuff. Is there any other questions about the test? I haven't written the test. I don't know how many questions are going to be on there. But they will look like homework problems because I'm going to be pulling from the same sets, the same problem sets. So they will look like homework assignments that you've done somewhere in these 23 chapters that we did, or I guess maybe more like 18 chapters or something like that, since we skipped a few. So no surprises. I'm not trying to trick anybody. I just need to know that you can do the basic math calculations that are necessary for these calculations that you need to do. If you can do those, great. Let's move you along. You can go into the nursing program and get your nursing or healthcare stuff taken care of, whatever it is that you're trying to move forward. I know some people are want to be EMTs, and some people want to be nurses, and so whatever. I'm not trying to put everyone in the same box by saying nurses. It's just a lot of times people talk about our nursing program, so that's kind of the thing I think of first. But whatever it is that you're doing next, we can move you along to that program and hopefully get you moving through. Okay, so everyone's good. No new questions. So watch WebAssign for those practice test and test as they show up. Okay. Will you be able to access the grades through Canvas? No, the grades are not calculated inside of Canvas, so those will not, your grade will not show up in Canvas. It will show up on that VC portal when I've submitted your final grade. Okay? Okay? Yeah. All good questions. Okay, great. So let's move ahead then with these last 3 chapters that we need to talk about. I think I talked about everything that we need to. So you don't actually have to show up for the final. That means we also, a week from today when we meet is like during the final. So you don't even really need to show up. I will open Zoom in case there's any kind of like emergency taking place. Someone can get a hold of me easily. But this is effectively, for most of you, this is our last class meeting that we will have. Okay? But obviously you can still email me, for the next week while we're finishing up the class and getting those kinds of things taken care of. Okay? All right, so let's look at things. So moving into chapter 21. Oops, that's a little too small. Let's go there. Okay, so basically the book takes and then as far as the modules, so the new modules are up, although I didn't find good videos that go along with these, but I think these sections in the book that we're looking at, these last few chapters, pretty straightforward. Like if you've learned the math so far for this course, you're going to be fine, because honestly it's the same stuff. It's the same dimensional analysis and then proportions, solving proportions. It's those same things. So it's just a little bit different setting. So chapter 21 is about heparin infusion calculations, and heparin is one of those drugs that comes up a lot, kind of like insulin. The book dedicated a whole chapter to insulin because you're going to be dealing with insulin on a regular basis. It's the same thing with this heparin, because heparin, I'll read it here because they sum it up pretty well. Heparin is a powerful anticoagulant drug that inhibits new blood clot formation or the extension of already existing clots. So heparin gets used a lot for for keeping blood from clotting. So it's the kind of thing that's used so frequently, like you're gonna see it on a regular basis, like the insulin, you're gonna see it. So you just want to get comfortable with it. So they have a whole chapter here about the heparin. Heparin is so commonly given, often post-operatively to prevent clot formation, that is actually prepared in ready-to-hang IV bags. Frequent checks of coagulation times during heparin therapy is essential. Heparin dosages are ordered based on clotting time and/or individual's body weight in kilograms. Subcutaneous heparin injections are given deeply at a 45-degree angle to discourage medication leakage through the injection tract and subsequent bruising. And then they even tell you here, there is no essential difference in the calculations you have already practiced for critical care dosages and those for heparin dosages, except that heparin dosages are subcutaneous injection and are measured using a TB syringe. So we've already looked at those TB syringes. So those were the ones where you had like the extra fine, like you could be a little more exact with them, right? So, however, heparin's action is so critical that it does deserve to be addressed separately. So that's why they're bringing it up, because it comes up a lot, and blood clotting or not clotting, it obviously is a big concern, especially when you've got IVs and all that kind of stuff. Someone just had an operation, this kind of stuff's important. So in this chapter, you'll be introduced to labels of a variety of heparin dosages, practice measuring heparin dosages for addition to IV solutions, and calculate units per hour infusing from milliliters per hour flow rates. So it's actually all the same math we've done before. They just want to make sure you're really comfortable with the heparin stuff. Okay? So we're going to look at a situation right here. All right, so they tell you if a commercially prepared IV heparin dosage strength that you require is not available, you may be required to prepare the solution yourself from a number of available vial dosage strengths. Let's stop and look at several vial labels. So same game you've been doing, right? You're going to look at a label. Here this bag's already prepared for you, right? That one's obviously ready to go. But you want to be able to read the labels. I think probably you're all pretty good at looking at labels now at this point and figuring out what needs to be done. More labels for you to look at and sort of figure stuff out. So you're probably starting to get the hang of this, how this works. Like here we've got, we've got calculating milliliters per hour IV flow rate from units per hour ordered. So because heparin is most frequently ordered in units per hour to be administered, for example, 1,000 units per hour, and infused using an EID, a common calculation will be the milliliter per hour flow rate. Let's look at these calculations first, keeping in mind that milliliter per hour flow rate for an EID is identical to the GTT per minute rate for a micro drip. Okay, so let's take a look. Example 1. The order is to infuse heparin at 1,000 units per hour from a solution of 20,000 units in 500 milliliters of D5W. So we've done this calculation for other things a bunch of times, right? You've got your rate on the left, you create your rate on the right. When you put both of those in there, it creates a proportion, and we solve for that. So what I just said makes it sound like it's some complicated thing. You're just setting up your fractions in a consistent way. Remember, units per milliliter on the left, so we do units per milliliter on the right. You're given in the problem 20,000 units per 500 milliliters, so it gives you the left side. On the right side, we know that we're going to infuse heparin at 1,000 units, but what we don't know is the hour. We're trying to come up with the milliliters, right? So we've got, what's that going to be? So you go through, do your stuff, you end up with 25 milliliters per hour, right? Because this is going to be, we're going to end up with, 40 divided, yeah, we're going to end up with 40x, right? Is that going to be 40? Yeah. So we end up with 40x equals 1,000. You divide both sides by 40, you get 25 milliliters per hour. So you're getting your milliliters per hour reading right here. So the flow rate to infuse 1,000 units per hour from a solution of 20,000 units and 500 milliliters is 25 milliliters per hour. So nothing real like new or tricky, right? Like 95% of the actual calculations you've had to do in the Math for Meds book were either these proportions that you have to solve, or it was the dimensional analysis. Hopefully this doesn't look new to anybody. And of course, here we go, calculation using dimensional analysis. So you can go through and use it also with the dimensional analysis. I'm always a fan of dimensional analysis. I feel like it's a little more rigorous. And plus it works every time that you need to do some kind of unit conversion. Dimensional analysis will work for you. There's a little bit of hand waving in how they set this up. a little bit, I would argue, which can then lead to confusion and errors and stuff like that. This is a fine way to do it. They're showing you. But the dimensional analysis, I just feel like, is a bulletproof method. Like, if you do it right, like it just all sort of fits together and makes sense. But let's look at how to do it this way. So we've got the order is to infuse heparin at 1,000 units per hour from a solution of 20,000 units in 500 milliliters of D5W. So calculate the milliliter per flow rate. So it's similar to what we did. We know we want a milliliters per hour. So then we put milliliters on top, units on bottom. Notice that's a little different than we did up here, or that last one. Put in a different order, but that's okay because we're following the units, which is the whole thing you're supposed to do with dimensional analysis. Okay, so then we know we're going to want these units to cancel because we don't want units in the final calculation. So we do 1,000 units over an hour. So now our units cancel, and we end up with the milliliters per hour, which is what we want, right? Units cancel, and we end up with 25 milliliters per hour, which is what we calculated a minute ago. A rate of 25 milliliters per hour is required to infuse 1,000 units per hour from a solution strength of 20,000 units and 500 milliliters. So you can just kind of see why I like this. Like if you look in the last example we did, and again, it's perfectly fine. It's in the book, and if you're comfortable with it, go for it. But if you look at this calculation here, where did the hours come from? Right? This is kind of why I think it's a little bit of a sloppier system. Like it might be fine for doing quick calculations as long as you understand what's going on. But if you're confused, I would say go with the dimensional analysis, because technically here, this is kind of a messy way of writing things. It would be perfectly reasonable for someone to go, where did the hours come from? I see units and then I see milliliters, but where did you get this hour? And the answer is a little bit of hand waving where we just inserted it in there where we wanted it to be. Whereas with the dimensional analysis, you see exactly where the hour came from. Oh, the unit came from right here when we did our 1,000 units per hour calculation. It's kind of hidden in the other problem, and that kind of stuff leads people to get confused sometimes. So I'm a fan of the dimensional analysis, but you should use, you're going to figure out what works for you when you're doing this stuff on a regular basis. Those of you who have chemistry in your future, more chemistry classes as part of the nursing and healthcare stuff that you're doing, you're going to use a ton of dimensional analysis anyway. So kind of get comfortable with that. Okay, these last few chapters are kind of on the shorter end. So you can see all these, it's the same stuff we've been doing where it's, here you're solving a proportion again, proportion, right? So you go through and practice these particular problems about how to do this kind of conversion, but you can see we're either using dimensional analysis to do these problems, or we're using the proportions, right? Nothing tricky or new or anything. Okay? All right, the new section, which is really just the last two chapters in the book, is pediatric medication calculations. And good news, the stuff that we're going to do in here is just like we've been doing. It's basically proportions or dimensional analysis. So if you're comfortable with either one of those things, you're good, right? Actually, if you're comfortable with both of them, then you're good to go, right? So let's take a look here. Pediatric oral and parenteral medications. So let's see, I make sure I have my numbers right here in my head, but there's only 2 new assignments, and I believe there's no homework for chapter 22 because there's actually not a lot of problems in here. It's mostly like describing stuff to you so that you know what's going on, like how you would do this procedure. But the actual mathematical problems are in the next chapter, chapter 23. Okay, so if you're looking around and going, wait, is there a homework missing? Is there one that I'm supposed to do but I didn't get done? No, there's no homework for chapter 22, so you don't have to stress that. In fact, let's look. Just to make sure everyone's comfortable, let's look. Week 19. Yeah, you can see chapter 21, chapter 23. Okay. Okay, so basically they're bringing this up because there's a few considerations you want to take care of when dealing with, pediatric type stuff. So that is people who are not, fully grown adults yet. So 2 differences between adult and pediatric dosages will be immediately apparent. Most oral drugs are preferred as liquids because infants and small children cannot be expected to swallow tablets easily, if at all. So that makes sense, right? anyone who's ever been around a baby, like trying to explain to a baby that it needs to swallow something that it doesn't want to swallow. A little tricky if it's a pill, something like that. And your dosages are going to be dramatically smaller, right? As we've seen, a lot of dosages are based on weight. Well, you know, a 180-pound man is obviously going to need a lot different level of medication than a 9-pound baby, right? These are different. So also it mentions in here, you want to take a lot more care with your margin of error with the smaller person you're dealing with. So if you're dealing with a baby, you really want to hit that target with your medication, which of course you always do. You always want to make sure you're hitting the dosage properly. But with babies, you need to be like, or, you know, not necessarily just babies, but small people, younger people. You need to be very careful to make sure that you're hitting that dosage right, so that you're not over or under medicating, right? The oral route is used whenever possible, but when a child cannot swallow or the drug is ineffective given orally, drugs will be administered by a parenteral route. So both the subcutaneous and intramuscular routes may be used depending on the type of drug being administered. However, the smaller size of infants and children limits the use of both routes, as does the nature of the drug being used. For example, many antibiotics are administered intravenously rather than intramuscularly. Okay, so we're going to see some oral syringes here on the next page. In fact, let me go ahead and switch over so that you can see what I'm looking at while I talk about it. Oral syringes have different size tips to prevent the use with hypodermic needles. We talked about that earlier in the course. We never want people using these for hypodermic use, partly because it's not sanitary. It's not really safe to do it that way, so they're kind of designed to do that. On some oral syringes, the tip is positioned off-center. We call this eccentric, to further distinguish them from hypodermic syringes, or they may be amber colored. So it's just a few different clues they throw on there to make sure you always catch, oh, this is not a hypodermic syringe. I should not be using it for that purpose, right? Got a calibrated dropper. So we know how those work. You pull the medicine up to a certain level, and then you can kind of shoot it into their mouth or whatever so they can go through. If they're a little bit older, you can drink out of these, right? You fill it up to the proper level and then drink out of it, so that you get the medicine, okay? They do mention here, care must be taken with liquid oral drugs to identify those prepared as suspensions. A suspension consists of an insoluble drug in a liquid base. Insoluble means it doesn't really dissolve in there. You might remember this from chemistry class, or sometimes if you're doing stuff in the kitchen or making a drink of whatever kind. Sometimes you get stuff kind of at the bottom of your drink, like stuff kind of settles down to the bottom. So that stuff is insoluble, right? If let's say you're making lemonade and you dump some sugar into it, generally that sugar is going to dissolve. So if you put a reasonable amount of sugar in it, and then you either stir it or you give it a few minutes or whatever, you can't see any more sugar, right? Because the sugar all dissolved into the liquid. Well, insoluble means it can't do that. It's not going to stay like the sugar does, where it just stays inside the liquid. It's not going to be able to do that. So like with lemonade, if you just keep dumping sugar in there, eventually it's not going to dissolve into the liquid. The liquid can't hold anymore. So what we're talking about is just stuff where it can't really hold any from the beginning. If you mix it up, it's kind of going to swirl up in the medicine, but then it's pretty quickly going to settle back out. And so that's what you have to be careful about, is that the stuff settling back out right away, because obviously that can mess with your ability to use it as a medication, right? So for example, the cefaclor oral suspension, which I'll show you. Let's go ahead and look at it. So it's just a label for the cefaclor. There's nothing really amazing to look at, but the cefaclor oral suspension, the drug the drug in a suspension settles to the bottom of the bottle between uses and thorough mixing immediately prior to pouring is mandatory. In other words, you have to mix it up right before you're going to measure it, because even if you put it down and then talk to somebody for 30 seconds, that medicine's already starting to settle out, which means if you're pulling from the wrong part of whatever, the vial or whatever, you're really not getting the proper amount of medicine that you want. So you want to make sure you shake it up, get everything all mixed. Suspensions must also be administered to the child promptly after measurement to prevent the drug from settling out again and an incomplete dosage being administered. In other words, if you're dealing with a suspension, you should be aware of it, and then you need to act fast in order to, collect the drug, measure the drug, and administer the drug fast before it starts settling out and becomes a problem again. Okay, suspensions must be thoroughly mixed before measurement and promptly administered to prevent the settling out of the insoluble drugs. Okay. When a tablet or capsule is administered, the child's mouth must be checked to be certain the medication has actually been swallowed, right? You're going to see this in many aspects of your career. Sometimes people don't take the medicine that they're supposed to. Kids do that as well. Adults, you're going to find adults who also don't take the medicine they're supposed to take, but sometimes children don't want to take it either. If swallowing is a problem, some tablets can be crushed and given in small amount of applesauce, ice cream, or juice if the child has no dietary restrictions to complicate this. Obviously, don't put it in something they're allergic to. You would think that goes without saying, but you see that in drug commercials now, right? When you see the drug commercial and it's, what does it say? There's a few of them that do it now, but you see like, don't take Taltz if you're allergic to Taltz. Well, yeah, isn't that kind of like, you'd think that would be kind of obvious, but apparently they need to put that in those things now, that you're not supposed to take a medicine if you're in fact allergic to that medicine. So the book's saying the same thing. Don't put it in applesauce if the person's allergic to applesauce. But that hopefully is obvious. Keep in mind, however, that enteric-coated and time-release tablets or capsules cannot be crushed, because the whole point of a time-release tablet is it's intended to have the medicine dispersed over a certain amount of time. If you crush it, that medicine's all now going to be absorbed all at once, and that could be a problem. That could be a problem for a number of different reasons, right? So you want to be careful about that. So for intramuscular and subcutaneous medications, dosage calculation is the same as for adults, except dosages are sometimes calibrated to the nearest hundredth and measured using a tuberculin syringe. So it's the same math behind the scenes. It's just that you want to be real exact when you're measuring it up, so you use that highly detailed syringe, or you may do that. Okay, so it's you can see that chapter is only like 2 pages in the book, so there's not much to it. Okay, then we get into here we go. Pediatric intravenous medications. So honestly, just working through a couple of examples in here, you're going to be fine, because the mathematics behind it, again, not new. We're basically looking at, this is very similar to stuff we've done in the last chapters. So the last few chapters. So if you were good with those, you should be good now. Let's see. Let me remind myself real quick here what I wanted to say on this first page. Oh, right. So infants and children, particularly under the age of 4, are completely developed physiologically, and drug tolerance, absorption, and excretion are ongoing concerns. Oh, incompletely. Sorry. They are incompletely developed physiologically, so they don't necessarily have the same physiology as like a grown adult. So you have to be aware of drug tolerance, absorption, excretion, their ongoing concerns. In addition, infants and acutely ill children can tolerate only a narrow range of hydration, making administering of IV drugs which are diluted for administration, a critical and exact skill. So you have to be very careful because over or underdosing or hydrating a child apparently can be an issue. Drug dilution protocols may specify a range for dilution, and on many occasions the smallest possible volume may have to be used in order to not overhydrate a child. Dosage and dilution decisions may have to be made on a day-to-day or even dose-to-dose basis and will involve the team effort of a nurse, physician, and a pharmacist. In addition, the suitability of a flow rate calculated for administration must be made on an individual basis. For example, a calculated flow rate of 100 GTT per minute for a 2-year-old child is too high a rate to administer. So it's not, you don't have as many options as you do with adults because kids can't take it as much. The fragility of infants and children's veins and the irritating nature of many medications mandate careful site inspection for signs of inflammation and infiltration. This should be done immediately before, during, and after each infusion. Signs of inflammation including redness, heat, swelling, and tenderness. They include redness, heat, swelling, and tenderness. Signs of infiltration include swelling, coldness, pain, and lack of blood return in the IV tubing. Either complication necessitates discontinuance of the IV and a restart at a new site. So basically you got to start over. IV medication guidelines are always used to determine drug dosages, dilutions, and administration rates. So there's nothing new here. You're going to be, taking information, and you're going to be converting it to the right thing that you want. Intravenous medications may be administered over a period of several hours or on an intermittent basis involving several dosages in a 24-hour period. So they basically give you the breakdown, your 7 steps right here, and you can see when we get into the examples, they're actually writing these 7 steps out for you. So you can see those 7 steps, follow along with the example, and then you should be fine when you go to do the homework. So, so the steps for adding a drug to the solution are as follows. Locate the type and volume of IV solution ordered. Okay, makes sense. Measure the dosage of drug to be added. Okay, that makes sense. Use strict aseptic technique to add the drug to the solution bag through the medication port. So obviously make sure that you're doing it in a clean way, right? Sanitary way. Mix the drug thoroughly in the solution. Label the IV solution bag with the name and dosage of the drug added. Okay, that's good. So that, like we already talked about that in earlier chapters. You got to always label everything. Got to initial your stuff. Add your initials and the time and date you added the drug. That's not anything new. We talked about that in the past. Hang the IV and set the flow rate for the infusion. Chart the administration when it has completed. So all of those steps are things we've done in the past. We're just sort of doing it in this situation now. There's a few details though. Regardless of the method of intermittent administration, the medication infusion is routinely followed by a flush to make sure the medication has cleared the tubing and that the total dosage has been administered. So since you might be dealing with such a small dosage, if the little bits left behind, that could make a difference, right? So they use a flush to go through, push all that necessary medicine through, and make sure everything's, all the medicine has really been administered. When IV medications are diluted for administration, it is necessary to determine hospital policy on inclusion of the medication volume as part of the volume specified for dilution. So what does that mean? That sounds like really complicated. It's actually not. Here's an example. So if 20 milligrams has a volume of 2 milliliters and it is to be diluted in 30 milliliters, does this mean that you must add 28 milliliters to get to the 30 milliliters? Or are they telling you to use 30 milliliters of diluent, right? Which one is it? Are you supposed to, so in other words, are you getting to 30 milliliters or are you getting to 32 milliliters? Apparently this is standard, and at least that's what the book is implying. This will be standard based on location. So if you're working at one hospital, then they'll have it set one way. If you're at another hospital, they have it set another way, which is just so you can keep it all straight, right? So you know, oh no, at this hospital, they mean add 28 to get 230. Because the doctors will know, and then if the physicians, if they know, then they're going to prescribe it knowing that they want you to get up to 30, right? So you just have to like keep that in mind. Hospital policies may vary, but in all examples and problems in this chapter, the drug volume would be treated as part of the total diluent volume. In other words, the book is going with the assumption that if you have 12 milliliters and you're trying to get it to a 30 milliliter solution, you would add 28. You're not being told to add 30. That's the way this book is doing those examples, but that doesn't mean that's how it's going to be where you work. You might have it the other way around. Okay? That stuff's not new. So let's look at an example. So a dosage of 250 milligrams in 15 milliliters of D5 1/2 NS is to be infused in 30 minutes. It is to be followed with a 5 milliliter D5 1/2 NS flush. So you remember, that's the flush we talked about. You're just flushing everything through to make sure no medicine got left behind. A volumetric pump will be used, and the tubing is a micro drip burette. Okay, so like I was showing you, they walk you through all the steps here, right? Walk you through them so you can see them all getting done. And then in step 3, they do the problem both ways, dimensional analysis or proportions, whichever way you're comfortable with. So read the drug label to determine what volume the 250 milligram dosage is contained in. Let's assume this is 1 milliliter, all right? So we're just assuming that the drug we got out is in a 1 milliliter volume. The dilution is to be 15 milliliters. So we run a total of 14 milliliters of D5 1/2 NS into the burette, then add the 1 milliliter containing the medication dosage of 250 milligrams. So do you understand what just happened here? We want the dilution to be 15 milliliters, and the medicine is contained in 1 milliliter. So what we do is we put 14 milliliters, we get 14 milliliters of the stuff ready, then we add the 1 milliliter that has all the medicine in it, and we now have 15 milliliters. So it's what we just talked about in that example a second ago. It's getting all that medicine prepared. All right, this gives the ordered volume of 15 milliliters. Roll the burette between your hands to mix the drug thoroughly with the solution. So you're just mixing it up to make sure it's all mixed in there. Calculate the flow rate for this micro drip. Okay, so that's where you got one of two ways of doing it. And they're both straightforward. Neither one of these should look strange to you. We've done calculations like this a ton of times, right? Either set it up as a proportion or the way that I prefer, but you know, if you're doing your job right, then you're doing your job right. You can use either one of these. The book suggests either one. You set up for dimensional analysis. We're getting 30 milliliters an hour either way. So you set the pump to infuse 30 milliliters per hour. You go through, label the burette to identify the drug and dosage added. Attach a label that states medication infusing. This makes it possible for others to know the status of the administration if you are not present when the infusion is complete and the pump alarms. So then they know, oh, you just had the medication just finished infusing. When the medication has infused, add the 5 milliliter flush. So we have that flush that we're supposed to follow it with, right, to flush all the medicine out. Remove the medication infusing label and attach a flush infusing label. This way, again, if someone comes along afterwards, they don't think that you were just infusing the medicine. They realize, oh, this is the flush. Otherwise, they may think that they need to do a second flush, because if they think that the first flush was actually the medicine infusing, then they may think another flush needs to be done. But it doesn't, because you just did the flush. So you're changing the label so that everyone knows what step we're on, basically, right? Everyone can be comfortable with that. Continue to infuse at 30 milliliters per hour. Chart the dosage and time. So, right, so that's basically what you're going to do for these. There's not a lot of variation in these. Yeah, you know, you're given the problem, you go through the steps, and you get it taken care of. And I think oh, and then using the dimensional analysis. Oh, that was just left over from the previous page. They keep showing you both ways to do it. So it's different variations of basically the same problem, depending on what units it is that you need. So if we go back, yeah, so we're still just finding the flow rate. So all those problems are largely the same stuff, right? Really the same things going on. So that's kind of the new material. Like I say, not that much new today. It's just they're kind of pointing out some special things. The heparin, you're going to see that a lot, so get comfortable with it. And then obviously you want to be careful when we're dealing with small, young children. Everyone wants, you know, young children to be okay. So obviously you don't want to be, you know, you want everything to go well for them, because they're a little more sensitive to variations in dosage and stuff like that. So it's just kind of dotting all your I's, crossing all your T's, all that kind of stuff. And that sort of wraps up the course. So I'll say to everyone, good job. You made it this far. You just have, you know, one more week, a little bit more work to do, and you'll be done. And then hopefully, you know, you move forward successfully in your program, whatever that program is, and you go from there. So good work. So just to kind of recap, you've got 2 new homework assignments. Like, most of the homework assignments are due tomorrow for the online homework, but you do have 2 new chapters. Or is it, did I just put 2 in there? I think there's just the 2, right? Yeah, just the 2. Wait, where did I put the 1? Oh yeah, there's one down here. So chapter 20 is due tomorrow, but then you've got chapter 21 and 23, you've got a few extra days to work on. So you've got that. And then make sure you watch this homework assignment too for the practice test, which will be showing up probably tomorrow, maybe the next day, but probably tomorrow. And then towards the end of the week, Thursday and Friday, the actual test will show up. You have a few days to take the actual test. It won't show up in Canvas. It will be here in the WebAssign. Make sure you get that completed by the cutoff for the final exam. Okay, so I don't want anyone to not pass the class because they just didn't do the test in time. So you make sure that you're aware exactly where you're going through and getting all that stuff. You're keeping track of all of it so that you can see what's going on. So with that, I will close the YouTube stream. I'm going to stick around and answer anybody's questions. If you have any kind of questions or concerns or anything like that, I'm happy to chat with you in Zoom. Otherwise, it's been a good semester. You can still, I'm saying bye just because we probably won't be in a Zoom meeting again, so I'm sort of telling you all I enjoyed the class. It was good. I learned quite a few things over this going through this book. Quite a bit of stuff I learned. So it was good. Keep up the good work, and good luck in your future classes and programs. Okay, thanks everybody.